name is Sarah. I'm going to be your provider today. First, I'm going to show my papers. These are going to be my papers that we utilize, and you can tell that there's no excess writing on them. And I'm just laying them right here on the bed. Okay. Hi, my name is Sarah. I'm your provider. What's your name today?
Maggie.
Maggie, and your age?
I'm 21.
Your birthday?
12/8/98.
And what brought you here today?
A wellness check.
Okay, and where are you?
I'm in a doctor's office in Louisville, Kentucky.
And who's the president?
Donald Trump.
Awesome. Today I'm going to take your vital signs to get started. It's our wellness check. And then while I have this going, I'm also going to put the pulse ox on and check your pulse and heart rate. Okay. This likes to flap over for me. All right. All right. Your blood pressure is 122/78. And your O2 sats are 99. Now I'm going to check your temperature. And then I'm going to check your heart rate and your respirations. (97.8) is your temperature. Okay, and your heart rate is 84 and your respirations are 22. All right, oh, I'm sorry, I'm so used to putting that on. Okay, now I'm going to check your hair. Is that okay if I touch you? Okay, and it's okay if I do your assessment today?
Yes.
All right, so your hair looks normal, non-dry, no oiliness, no flakiness within the scalp, and no visual open areas. Now I'm just going to no tenderness, no lesions or no nodules noted. All right, so now if it's okay, I'm just going to look at the symmetry of your face. Everything is symmetrical, no lesions, no open. I'm going to look at your skin, okay? Her skin is warm to touch, no opened areas, no lesions, no nevi noted throughout all extremities. You do look a little tan. Have you been to the tanning bed recently?
No, but I got a spray tan.
Okay, spray tans are much better. That's much safer. Please avoid tanning beds because that increases your risk for cancer. Okay, so now I'm going to look at your ears. If you look at the measure, they're symmetrical and even. I'm going to assess. I see that you have piercings. Any tenderness with that?
No.
On your helix or anti-helix?
No.
Any issues with your piercings?
Mm-mm.
Okay, no drainage, no redness, no pain.
No.
Everything looks good on that. Okay, so now I'm going to check inside your ear. With that, I'll get to look at your ear canal and your eardrum. Okay, your eardrum is visual. Your tympanic membrane is pearly and gray, and the cone of light is present. I do see some increased serotonin present in this ear, but it's not blocking any visual of your tympanic membrane. Okay, now I'm going to look in this ear. I am able to see your tympanic membrane and the cone of light, and it is also pearly gray, no bulging in either, and decreased serotonin in that ear. Okay, now I'm just going to have you turn this way, away from me. Thank you, and I'm just going to test your hearing really quick. I'm going to say 3 letters or 3 things, and I'm going to let you repeat them back to me, okay? I'm going to do it on each ear.
AP6.
And
594.
perfect. Her hearing is good on both sides, and now I'm going to test. Okay, with this I'm going to hit it. You're going to feel vibrations on the bone behind your ear. Let me know when you no longer hear that ring. Let me know when you hear it, and then when you no longer.
I can hear it. I hear it.
And when
Just
just
stop.
perfect.
I hear it. I can hear it. And it stopped.
Perfect. All right, hearing is equal bilaterally on both sides, and there's no issues there. Now, if you turn this way just so the camera can see just a little bit, I'm going to look at your eyes. Your eyes are symmetrical. Eyelids, there's no ptosis. They stop right above the iris, and there's no issues, no lesions, no nodules, and no along the eyelids. Her eyelashes are intact, and then her sclera is white, and the conjunctiva is pink, and there's no drainage noted. Now, if it's okay, I'm going to take a look inside. And with this, I'm going to look at your cornea. Red reflex is noted. Red reflex is noted. There's no apostrophes, no nicks. Everything looks intact bilaterally on both eyes. Now I'm going to check your visual acuity. And with this, I'm just going to measure to get this to the right distance. And we're going to be checking this in both eyes. Okay, with this I want you to cover one eye and read the lowest line you can read.
L, T, F, P, H.
Perfect. And now cover the other eye and read the lowest line you can read, but backwards.
H, P, F, T, L.
Perfect. And that's for your visual acuity. And it was 20/20. Are you wearing any contacts today? Okay, your visual acuity is 20/20 bilaterally with no visual assistance like contacts or glasses. Okay, now I'm going to check your reflex or your light reflex. Okay, for your pupils. Okay, like I said, your pupils are equal and reactive to light and DNC. Everything looks good, and there's no issues there. Okay, now I'm going to check for your visual fields. If you'll just follow my finger, I want you to look up when I point up and just follow my finger. Perfect, there's no issues there. Now, if you follow my finger and look at the wall, perfect. There's no issues with her vision. She has vision in all visual fields, and she's able to accommodate. Now I'm going to check for your peripheral vision. Let me know when my hands first appear, and then you can also let me know when you see something moving.
Your left is moving.
Perfect.
Your right is moving.
Okay, perfect. Her peripheral vision is intact bilaterally, and there's no issues there. Now I want to check your cranial nerve number 1 with your smell, and I'm going to have you close your eyes, and I have 2 different smells, and if you could please let me know what those are. First, close one nostril and breathe in. Okay, that is patent. Do the other side for me. And you can turn this way a little bit so the camera can see you. Okay, now do the other side with your finger closed, and I want you to tell me what this smell is.
Lavender.
Perfect. Okay, now I've got another cotton ball. Close that other side.
Peach.
Perfect. Olfactory is intact bilaterally, no issues there, and everything is patent. Now I'm going to take a look in her nasal cavities and see what I can see. Okay, is it okay if I use this? Okay, just going to look up. Alright, there is no redness, no erythema, no drainage. I am able to see her turbinates upper and lower, and there's no issues with that. We look on the other side. I am able to see all turbulence, no redness, no drainage. Everything looks intact there. And her septum bilaterally is not deviated. Her nose is symmetrical bilaterally. Everything looks good there. Now I'm going to take a look at your mouth. Okay, your mouth is even symmetrically. Is it okay if I have you open your mouth for me? Okay. Now stick out your tongue for me, and can you move it to either side? Perfect. No issues there. Okay, stick your tongue all the way out for me, and then I'm going to have I need you to open up, stick your tongue out, and say ah. Uvula moves up midline. No issues there. And then now I'm going to look at each side of your mucosa. I'm going to put my gloves on for that. And then I'm also going to look at each side of your tongue to make sure there are no deviations there, no lesions. Okay. First off, I want you to open your mouth for me. And I am going to use my pen light just a little bit just so I can see. Okay, can you open? Okay. Normal dentation, everything looks good. No visible cavities noted. Tongue looks good. Her mucosa is moist. No lesions or nodules noted. Now, if you could stick out your tongue for me. Okay, I am just going to wrap this around your tongue just a little bit, just so I can feel each side. There's no nodules or lesions noted. Do you smoke or
No.
use any type form of tobacco?
No.
That's great. Thank you. All right. Now I'm going to check your cranial nerve number 7, and that I want you to puff for me, smile for me, frown for me, raise your eyebrows for me, close your eyes tight for me. Okay, those are all intact and there's no issues there. Now I'm going to check your sensation and your mastication. Okay, first I want you to open and then close your jaw. Perfect. And then the same here, open. There's no problems with TMJ, no pain with that, correct? Okay, and her cranial nerve is intact there and there's no issues. Now, if you could, I'm going to check your resistance for me. Okay, I want you to push up, both your shoulders as well. Perfect, and then down. Okay, now try to resist me. Perfect, perfect. Okay, now what I want you to do is I'm going to feel all of your lymph nodes. Preauricular, non-palpable, post-auricular, non-palpable, tonsillar, non-palpable, posterior cervical, non-palpable, superior cervical, non-palpable, premandibular, non-palpable, mandibular, non-palpable. Now I'm going to look here. Okay, I want you to raise your shoulders up, non-palpable, and then shrug one more time for me. Perfect. Subclavicular, non-palpable. No notable lymph nodes in all areas. Now, what I want to do is I want to check your cervical spine as well. I want you to tilt your head to your each side for me, and then rotate. Perfect. And then down. Okay. Any tenderness here? Perfect. Okay, that was C7 and T1. There's no issues there, and cranial nerves are all intact. No issues. Okay, so now I'm going to have you turn around, and I'm going to listen to and do your lung assessment. Perfect. Now with this, I'm going to have your hair moved over to the side. If it's okay, I'm going to just move your shirt up just a little bit. Perfect. Okay, first thing I'm going to do is check for tactile firmitus, and when I put my hands on your back, I want you to say the words 99. Okay?
99. 99.
Perfect.
99. 99.
Perfect.
99. 99.
Perfect. Okay, tactile firmitus is noted throughout. Now, I want you to take a deep breath when I put my hands on your sides, and I'm going to look for even rise bilaterally in all fields. Okay? One more time. Perfect. Even respiration and rise bilaterally on all fields. Okay, now I'm going to auscultate on your lungs. Just take a deep breath in and out for me. Perfect. Perfect. Just going to lift this up a little. Perfect. Okay. Now I'm going to do some percussion. Tympanic resonance noted throughout all fields on her all lung fields. No adventitious breath sounds noted, and lung sounds were evenly distributed and clear throughout all areas. Okay, so now I'm going to have you turn around this way for me. And on her skin on her back, everything looked good. There were no nevi noted, no lesions, no nodules, everything was intact. Okay, so now if it's okay, I'm going to have you lay down on your back so I can continue your lung exam and then move on to your heart. Okay? So with this, if it's okay, I am going to move your shirt up just a little bit, and we'll have to leave that. You can just tuck a little bit. All right. Now, I'm just going to continue with the auscultation. Just a short, deep breath. Perfect. 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 Okay. Now I'm just going to go under just a little bit on the other side. And then I'm just going to have you lift this side of the arm. Deep breath. One more time. And then on this side for me. Perfect. No adventitious breath sounds noted. Everything was even. Respirations were clear on all lung fields. Now I'm going to do the 99 again.
99. 99. 99. 99.
Perfect. Okay, now when I listen to you, I'm going to look and I want you to say the letter E for me. I'm looking for some cacophony. Okay? Just say E when you feel my stethoscope.
E. 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 E.
Everything was within normal limits, nothing abnormality The letter E was heard, no letter A was heard, everything was with normal. Now if it's okay, I'm going to look at your jugular vein, and with that, I'm going to use my light just to see. I'm looking for distension of your vein. In palpation, jugular vein palpation noted, but no distension. Palpation is noted. And now I'm going to do measurement. I'm looking at your sternal notch. I see the maximal point, and it is noted right at your sternal notch up to measuring at 6 centimeters. Okay, you can turn back this way. Now I'm just going to feel your carotids bilaterally. Carotids are palpable bilaterally. They're brisk but not bounding. I am going to take a listen though. And I'm going to use the bell. Carotids are auscultated. Again, there's no bruise noted, no thrills noted, everything within normal limits on her carotids. I am able to visualize the point of proximal endpoint, proximal, the PMI, everything is within normal limits, and that upon palpation is also noted around the 6th intercostal space. Now I'm going to take a listen to your heart. Listening at your aorta, your pulmonic, your tricuspid, so sorry, and your mitral. Now I'm going to listen with the bell. Again, all the same. The aortic, the pulmonic, the tricuspid, and the mitral. They are all within normal limits. I hear S1, S2, no S1, S2 split. I'm not hearing an S3 or S4. Everything is within normal limits. Now, if it's okay, I'm going to move on to your abdomen. On visualization, there's no neva, no lesions, no opened areas. Your umbilicus is within centered as it should be. I'm seeing no visual pulsations, and everything looks intact. So now I'm going to auscultate your abdominal aorta. Then I'm going to auscultate your femoral, your iliac, and your renal. Sorry if this is uncomfortable, I'll be quick. Okay, now I'm going to do that with the bell. I'm going to do the same again if you're okay with that. Your abdominal, your femoral, your iliac, and your renal arteries. Perfect. Everything were able to be auscultated. There were no bruise or thrills noted, and when I palpated, the same. I haven't palpated down here. It's okay if I do that? And I'm going to palpate your femoral arteries, and while I'm down here, if it's okay, I'm going to palpate your lymph nodes. all arteries were palpable, no lymph nodes noted, and no lesions noted. Everything, was there any tenderness in that area? No abnormalities noted in her lymph nodes or along with her arteries. Okay, now if it's okay, I am going to palpate. First I'm going to listen to your stomach, listen to your bowel sounds, because the palpation can irritate that. All 4 quadrants. And I'm doing it with the bell as well. Your bowel sounds are present in all 4 quadrants, but not hyperactive. Everything looks good there. Have you had any issues with your bowels? Awesome. Okay, so now I am going to palpate. First I'm going to start with your liver, and then I'm going to palpate for your spleen and kidneys as well, okay? Okay. First I'm going to percuss for your liver. And just put your finger right here for me. Okay, and it stops right there. I will measure. Okay, your liver measures right at about 6 centimeters along the mid-clavicular, and it stops right about the 9th or 10th. Okay, intercostal. All right. Now I'm going to palpate your spleen. Okay. And percuss. Negative for percussion and palpation on your spleen. And on your kidneys, I'm going to percuss. Okay, your kidneys, I could not percuss. Your spleen, I could not percuss. I'm going to palpate. I know that's a little, can you breathe in for me? And out. In. Okay. Your spleen is not able to be palpated. Now let me do your kidneys. Okay. And this side. Now that's a little uncomfortable. Okay. And your kidneys are not able to be palpated. Now I'm going to do some light percussion or palpation on your stomach. First I'm going to do the percussion. Normal tympanic resonance along your abdomen. No areas of concern there. And light percussion, just let me know if this hurts. Any pain with that? Okay. Okay, now I'm going to go a little bit deeper. Okay. Any pain with that? Okay, any pain along the inguinal areas?
No.
Okay, is it tender along your kidneys? Your bladder?
No.
Okay, all right. So her abdomen is negative for any abnormalities, no tenderness, and no pain. That's great. Okay, now I'm just going to check your joints. Any tenderness there? Any tenderness here?
No.
Any tenderness here?
No.
Perfect. Okay, now I'm going to have you bend your knees. I do just want to check for any tenderness on your abdomen when I'm palpating. Any tenderness there for the light palpation? Okay, any tenderness in deep palpation?
No.
Okay, perfect. Okay, so now I'm just going to check your active range of motion. Can you straighten your legs for me? Can you cross your legs over? Okay, can you uncross them? Perfect. Now can you point your toes down, point your toes up? Perfect. Okay, now I want you to bend your knees for me. Okay, I'm going to want you to do this against resistance, okay? Can you resist? Resist. Okay, straighten. Okay, resist. Resist. Okay, now I'm going to pull your legs together. Resist. And push out. Resist. Okay, perfect. Now if it's okay, I'm going to have you sit up. Perfect. Okay, now I'm going to have you put your arms up this way. I'm going to have you resist and resist. Okay, and now do this and do that. Perfect. Any issues there? And straighten them up. Okay, resist, resist. Okay, put your hands up. Resist and resist. Okay, do your fingers like this. Okay, resist. Okay, perfect. Now spread your fingers out like this and close them together. Okay, now resist. Okay, and now resist. Perfect. Okay, now I'm going to check the sensation really quick. I did not do that on your forehead, so I'm going to do it all throughout your body. This is on your sensation. Can you tell me if this is sharp or dull?
I got sharp, dull.
Okay.
Sharp, dull. Sharp, 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 dull, 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 sharp, sharp, dull, dull, sharp, 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 dull, dull, sharp, sharp.
Perfect. Sensation on all upper and lower extremities are intact. There's no issues there. Now I'm going to check your reflexes. Okay. First I'm going to check your upper extremity reflexes. Okay, that was +2. Let's do this side. Okay, that was a +2. Perfect. Now we're going to check. Go. Perfect. 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 Okay. Her upper extremities were +2. Now I'm going to check for your pulses. Brachial pulses are palpated. Radial pulses are palpated. We already did her carotid pulses. Okay, now I'm going to check your reflexes over here. No, she's having trouble moving the camera. Okay, now I'm going to check your reflexes here, your lower extremities. Okay. Okay, perfect. Your reflexes bilaterally were normal. You had a +3 reflex response on your right lower extremity and a +2 on all other extremities. So you were 5 out of 5 on your passive range of motion, and your active range of motion was normal within all upper and lower extremities, 5 out of 5 in upper extremities and 5 out of 5 in lower extremities. Okay, now I'm just going to have you check, stand up for me. Okay, now can you bend over? Perfect. I'm just going to check your spine. I'm going to raise your shirt a little bit. Your spine is straight and symmetrical, no issues. Stand straight up for me and over to the side just so we can see it in the camera. Just straight, there you go. Okay, it's just straight for me. There's no curve in the spine, the normal curve here, the normal curve in here, and no issues there. Okay, now can you turn to your side here and the other side? Perfect. All right. And then just can you walk for me straight? Perfect. And then can you walk back heel to toe? Perfect. Gait is within normal limits, no issues there. Now, can you point your toes up and walk on your heels. Heel the toe. Perfect. Okay, now can you have a seat for me? And there was one more sensation that I did forget to check. Can you do this for me? Perfect. And then can you do the other side for me? Perfect. All right, her all sensations are intact. There's no issues there, and everything is good. Do you have any questions for me today?
No.
We talked about the issues of possible skin cancer with the tanning bed, and I believe that is all that we have for today.
All right.
Thank you very much, Free.